Yeah. So here we are breaking the inertia in this 2 hours. We are breaking your inertia 100%, not 5%. Yeah, because our mind is telling us if this patient has gone to 7 doctors already and they told her impossible, there is nowhere else they go. So we are taking the responsibility in taking care of them as a patient, not as a profitable project customer. Okay. Now, we want to know, with your sharing your opinion, should I or shouldn't I treat these patients that we're going to talk about with implants? So you're going to participate in giving your opinion, all of you. Now, here is the time that I need your mind to help. I cannot ask all of you for 4 cases because it will take the whole 2 hours. So all of you should at least find one patient in your memory. Either it was a philosophical patient, and you have to tell me who was this patient, or they were exacting patient, or they were indifferent or hysteric. Choose one. Think of the patient, the first patient that comes to your mind, put them in this category and tell me the story of that one patient. One is enough. For example, if you give me a hysteric patient that you saw in your clinic, enough. If you give me indifferent, enough. If you give me also hysteric, one of the 4 is enough. We start from you. Philosophic means he's Jibreel. You know Jibreel?
Yeah.
Philosophic is Jibreel. Whatever you say, they say thank you, they hug you, they give you a gift, they call you, thank you, that's philosophical.
No, that one, he was interfering in the treatment.
Okay. How?
Whatever we tell him that we will do or we will give this medication, he said that yes, I studied in medical school 2 years from 40 years ago, and he did not continue the study and studied different branch, but he thinks that he knows everything about medical and dental.
Okay. So that's not definitely philosophical. That's probably something not even exact. That's more of a hysteric without shouting.
He was calm.
No, but what you're saying is a crazy patient, which is here, but
Yeah,
without
but
shouting.
no shouting. No shouting.
Choose one. Indifferent, yeah. Indifferent means they don't come on time, they don't pay on time, they change dentist quickly. You tell them instructions, they don't listen, they don't care. They come whenever they want. If it's little far from the house, they go to another dentist.
I have one dentist,
cheaper dentist, Instagram dentist, TikTok dentist.
one patient, my story with him is...
No, which category?
I don't...
You tell the story, we
cannot,
put him, yeah.
I make a full mouth for him, advise him to take vitamin D, advise him to stop smoking, and he doesn't listen to me. After 5 years, some implant failed, make another implant, and also not listen to advice. With that, I give that advice. I hope to not listen to me.
Yeah, so this is indifferent. They don't care. Whatever happens, they find plan B.
After that, he told me I will not stop smoking.
Okay?
Even this implant will fail, I will make another.
Yeah, they're indifferent. Okay? Also indifferent. Tell us the story.
It was a veneer patient. He
Okay.
came to do veneer just because his wife wants him to do veneers, not because he wants to do it.
Uh-huh.
And whenever I used to ask him what kind of
Color, shape, thing.
yeah, he doesn't care. He asks his wife.
But does he brush his teeth? Does he
Yeah.
come on time?
He's indifferent. He doesn't care much about appointments and all.
Ah.
His wife was the one to push him to
Yeah.
come into
Okay.
it.
There was a patient, she was hysterical. The first session, she did her
There
teeth.
is a difference between historical and hysterical.
Hysterical.
Ah.
Yes. And yeah. And she asked for big discount. Next time she brought her kids and she wants to do their teeth. So she asked for big discount. We can't do this big discount. She asked, I want to refer her to another doctor. She refused because she wants me. So she forced me to do all with shouting and bad words, but like your prices are very high, expensive, but I want you. So she
But this
forced
is
me.
not hysterical. See, hysterical means crazy.
Yeah,
Means
she was crazy.
oh, okay. Crazy.
Yeah, because she forced me to do their
Uh-huh.
teeth, her kids' teeth, but she doesn't want to pay.
This is a Karen.
This is a Karen in the name of the patient.
Yeah, it's used as a name and as something else. So she was a Karen most probably.
I will, as we go deeper, we will understand the character of this. Continue your case.
Okay, mine was hysterical.
Also,
Yeah. So
see, none of you remember the good ones who
Yes.
pay on time, the philosophical, who give you bonus. I had a patient from Yemen. I gave him a card. I have made 3 cards like that in my life. It's a red color. They can pay whatever they want and they go. It says pay whatever you want, even if you pay 0. No. The patient said, what is the bill? 2,200. He said, no, it's too little. What is this? The reception is saying, the lady to take the money, this is the bill. No, this is impossible. Ask the doctor, there must be a mistake. It must be at least twice, 3 times this amount. So we have philosophical patients also who appreciate a lot. So I hope you also mention those also. Not all hysterical. Yalla.
So we did all on 4 for her, upward, and we explained everything, and she signed all the papers and everything. After treatment, when she came to take off the stitches 10 days later, she actually demanded that we did also grafting, bone grafting, buccal, vestibule area. She demanded that to put for her a temporary denture immediately. And she wouldn't leave the clinic. She went berserk, and she wouldn't leave the clinic. She sat in the clinic. She didn't let us bring anybody in from the waiting area, and she just wanted her way. So in the end, we just left her there. She got tired. She left, but she came back again for another visit.
Your turn.
Oh, hysterical. Stuck in mind.
Yeah, okay, tell us.
The patient came with full mouth veneers. So what is the chief complaint? I want to remove the veneers. What is the next step? No, just remove. But this is not. We need we need to make the treatment plan for the next step. I can't remove and keep it as. And he shout at me and go to the reception, make big problem because I refuse to remove because we need to.
Yeah, the
do
tooth
the
becomes
next step.
sensitive, decayed, and then
There is bleeding gum, and so we can't. So this is hysterical.
yeah.
Another example, as the bill, about the bill, when he saw the bill is normal or not, he said no. So what material you put in the? I don't think this.
Good material. No, this is the opposite of philosophical. This is mistrust. Yes, Firas.
So I had some philosophic patients, but when you're asking that I left my safe zone with them, usually philosophic patients
No,
always.
you don't have to leave safe. It's always
Yeah.
fun. Yeah. No, no.
So-
you tell us whatever you want.
Yeah, so for my patient, she was hysterical. She's a very nice lady, but she has a history with like she has some scar on her cheek. I think it's because of a handpiece injury. And that patient, she was very nice until she sat on the dental chair. Then she starts acting crazy, and she sometimes stands up and starts hitting her head with the wall, and she was very hard to deal with. After we started treatments, it was like baby steps, like I'm treating pedo patients. Slowly, she changed to being let's say exacting patient at her best.
Yes, no, no, you.
Okay, I cannot classify the patient.
Tell the story, we classify.
Yes. Should I have many patients? One patient, he keep coming to me. Last time he couldn't come because it was in Ramadan and it was not exactly time. So he go to another clinic, but he called me. He make me call to talk to another dentist. What she should do, what the situation. He do the treatment while I'm with him in the phone. So I don't know what this patient, what you.
Exacting. He wants one thing, only you can do. This
So
is
yeah,
exact.
this patient I have.
All right, we have to wrap it up. This is the last.
I have one patient. He does not care about his appointment. When he come to the clinic, only he came for the laser offer. He does not care about his teeth.
All right, so now you get the picture of what we are trying to do. We're trying to quickly understand where these patients come. Now, in 1978, all of you remember when you studied fourth year by house classification, this classification. Now, I want to take you one step after this, right? So, what happened in 2003? How many years? 25 years later, after house, another guy came by name Gamer, Gamer, and he said, "Are you willing to change this from hysteric to maybe indifferent, maybe exacting, from indifferent to exacting, from exacting to philosophical, or even from hysteric as much as possible to change this to this?" I want you to open your phone and I want you to put it on camera on yourself. So open the camera, not on me, on yourself. Look at your own face. Now remember the stories that you heard. I wish everybody told the story, but the newcomer, still he's not joined yet. The ones who already told the story, I want you to look at your face. Remember that patient that you mentioned. Your camera is on your face? Okay, on your face. Remember the patient, the story you told. Now look at your own face and remember, if you can, how you look like. Were you ideal dentist at that time? Were you a submitter dentist at that time? Were you a reluctant dentist when that was happening to you? Or you are a resisting dentist? This is what Gamer talked about. After 25 years from that study, he came and said, did you look at yourself when that patient was hysteric? Did you pay attention to how you... See, he was the only one, Faraz, who said, I did baby steps. I changed the patient from here to here. Because he was paying attention to who? Not to the patient. He was paying attention to himself, to change himself while the patient was... There is a book called Let Them Theory. Have you read this book? You say you don't have time to read dental book. What is Let Them Theory book? This Let Them Theory book is about a lady who had a teenager and elder uh, daughter and a teenager son. He sent her to the camp. Told the son, how many of you with kids, raise your hand so you understand. My only two, three. Okay, but this is a teenager, so little difficult. So teenager, you have to tell, don't smoke with your friends, don't go late night with girls, don't do this, don't do that, don't get in trouble. Camp, they can do whatever they want. Make sure you go back to your room when you want to sleep. Don't sleep here, there. Don't swim. It's too cold. You tell some instructions. So this son went. They called the mother late night. Your son did this, did this, did this, did this, did this. So the lady was panicking. The author of the book. This is the lady who wrote the book. And the daughter is standing and listening. Little older daughter. She's saying to the mother, let them. He went swimming 12 midnight. The daughter was, and she was like, oh, I told him not to go. The daughter, let them go swimming. He was shouting and he was throwing apples on the. Daughter was saying, the sister of that kid, let them. And the mother was getting crazy. When she sat down, she wrote this book. If I could do this, let them do what they want, I would have been a happier person and a more productive person because they are responsible for their actions. So when the patient is hysteric, let them be hysteric. But you decide what you want to do. So the next chapter of the let them theory is let me decide what I want to do when they are doing what they want to do, but I don't control them. So giving instructions is very dangerous because you don't allow them to be who they are. But you can change. That's what Gamer is saying. Gamer is saying if the patient is hysteric, look at yourself in the mirror or in the phone now, nobody has a mirror, and you decide what kind of a dentist you are while they are exacting, while they are hysteric, while they are philosophical, while they are, you decide who you are. And he proves in his article with thousands of patients that if the only formula, the only key, secret key, master key opens all the locks, the only master key is to get the trust of the patient. Once you get the trust, they change from this to this, from this to this, from this to this. How to get the trust depends how you behave. You behave like an ideal dentist, that's the best. Or at least, you understand? So, the blame, if you say I have a hysteric patient, is only on you. Plus, this let them theory, let them shout. That's not going to affect you. Shouldn't be affecting you. You should affect yourself. Not the patients shouting should affect your behavior. So this is very difficult to apply in the beginning, but once you understand what Gamer is saying and you start trying it in a real life when the patient is shouting and you become not affected, let them do what they want, but let me be the whoever I want, then you can see if I can get the trust, suddenly they become different. Suddenly they behave different and suddenly they keep becoming different. And you took them from somewhere which was not possible to treat to a person that you can. So, what Gamer is saying, look at yourself, right? Be ideal, submitter, or reluctant, or resistant to this patient. He added also indifferent. As a dentist, sometimes we become indifferent. We say, you know what, leave it, who cares? Oh, I have enough in my house. My wife is shouting, my kid is this, Dubai Health Authority fine every month. Who cares about this idiots? Let him go, let him what? So indifferent is added in gamers. This 4 plus indifferent. I didn't put it here because it will confuse you, but I added it. So this is the summary of what Gamer is saying. Gamer studied House's classification and he said, now it's your turn as a dentist to behave differently when patient is behaving like this. So he added indifferent as one of the behavior of us as dentists while this is happening. Yeah. So he says, whatever you do, because he cannot change you. This article cannot change your behavior, right? He says, whatever you want to be. If you can get the trust of the patient, he proves with data, the patient will move towards philosophical. It will move, and he proves it. And we tried it with many of you, and it is working. The theory is working. So the doctor's response to the above behavior will change the behavior. So for people who don't know what's philosophical exactly in different history, philosophical is the ideal patient who listens to you, comes on time, pay on time, thanks you, everything is perfect. Exacting is they want one thing, if you give it to them, they love you. If you don't give it to them, they hate you. Indifferent, they don't come on time, they don't care. You do whatever you want, color, shape, size, form, brush, they don't brush. Whatever they want, they do, and you cannot change their interest in their teeth or their mouth or their life even. The hysteric is, their logic is not possible. They want something, if possible, on planet Earth by these laws of Newton, they don't agree. They want something totally irrational, which is not logic. And they stick to that and they repeat that. And if you don't understand, they shout at you or they say bad words or whatever. Now let us be convinced that the dentist, once they get the trust, the patient's response will improve. So according to House, psychological examination in house means in the clinic is also related to yourself, not only related to the patient. So once you start looking, half of the face is you and half is the patient, then it's easier for you to make one final judgment. The other thing we have to respect is what is the difference between the terminology, process and event. When you go and attend a movie, 2-hour Grammy Award movie, fantastic, or a concert, or your daughter's playing piano or dancing ballet in front of, this is an event. It has a beginning time, it has an ending time, you clap, you go home, you sleep, next day you go to your work. This is an event. Process takes years to do something. Like the process of, for example, give me a process of how Burj Khalifa is not a, to build it, it took say 5 years, 7 years, 5 years I think. That was a process, but it had an end.
Overcoming fear.
Yeah. So, for example, to have the government of say US, what kind of a government they are running? They're claiming they are running democratic. To get to this, it takes a process. Change laws, add laws. Here they have this sheikh way of running. That's a process. It took them years to become like this. Say in Switzerland, they have a different process. For example, education took a process for us to know. We go 12 years in school, then we go 4 or 5 years in college, then we become master, then PhD. Process of education, it's a process, takes years to enter this process. Now, the patient, normally that they come to you, say they are in their 50s or 60s, it took them 50 years to lose their teeth, to lose the bone, to lose the gum, and they come to you. It took them a process. It wasn't as soon as they saw a small hole they came. They waited extraction for years, they didn't come. Then the teeth moved, they didn't come. The bone resolved, they didn't come. Now they come to you with so many issues, which took a process to reach to this stage. They come to you to treat them in an event. They want it tomorrow. Can you fix this? No, they want you to fix it. They ask you, can you fix this? You said yes. Can it be like in 1 week? Or you said no, I need 6 months. 6 months? Because they don't understand. It took them a process to reach where they are. You also need a process. First you need to take care of the infection, extract, let it heal, So to understand this yourself, that it needs a process to solve a process, they have to understand this logically, then they will be more cooperative. If you tell them this is not an event, it's not a feeling, it's a process. Same way when you send your kids to school, it was a process to teach them how to sit and write and read. So, any of you don't agree with the 3 statements above? Raise your hand. All of you agree? No? You disagree? Which one you disagree with? Huh? Okay.
I disagree with patient's thoughts against logic.
So, patient's thoughts will see, you have a logic, means you do bone graft, you need to wait 6 months.
Yeah.
Patient thinks that the reason you're delaying the bone graft is because you want to charge more. He tells you, no, I don't want to wait 6 months. You say, but I need 6 months for the cells. No, sorry, I need you to finish it. So the logic is the cells require 6 months to do bone formation because of the Johnson's theory. We know from 1961, we know the article how the bone is formed after extraction. We know the cells, we know the maturity, we know the oven bone, then cancellous bone, then cortical bone, right?
Yeah.
We know this, how this formation of bone takes 6 months. So their thoughts is based on whatever they saw on YouTube or whatever. Their thought is the more you wait, something will go wrong, or they will be charged more, or they don't understand that this is needed. So their thoughts normally wins the logic of the right logic, which is scientific logic. Even if, I don't want to mention countries, but many patients come from other countries who believe in superstition. And when you say a suggestion, they say, I will go to the mosque and I will do istikhara with my priest, and then I'll get back to you. So they go, they sit down, they pay some money, the guy will say, do it or don't do it. So this is, the thought wins the logic. Okay. All right, so we'll talk about these 4 cases today. First case is about Mr. Sultan. He comes like this. He is 70 years old and he presents this scenario to me. You can see across, deep vertical dimension is totally collapsed. You can see the roots are almost the dentin is exposed, some old porcelain fused to metal with open margin everywhere, collapsed vertical. Patient cannot eat, patient is hurting himself. There is some pus here, so the patient also has pain, and it's not any longer practical for him to continue like this. So he comes to me for treatment. Now, looking at this and the patient's age and this, the question is, should I or shouldn't I treat this patient with dental implant? People, I don't need to explain. I need hands, including non-dentists in this room, everybody in this room, anyone in this room. Raise your hand means you think we should do implants. If you don't raise your hand means I don't think this is a good case for implant. Please. So 50%, 70. So say if we are 25, if 5 people didn't raise, that is 80% they think we should, 20% think we should not, for such a case, do implant. Alright. Let's say reasons to abort mission means don't do implant. This patient is not listening, he is hysteric, he shouts, his son shouts at me, what is this, I want this immediately, immediate loading. Patient keeps saying he does not want to continue after sitting on the chair, he wants to leave. So I'm trying to, what is G-snub in English? No, check his pulse. The G-snub means as the patient is talking to you,
Check the behavior.
you are becoming house and gamer. You're looking at yourself, Suhail, how are you behaving? And you're looking at the patient, is he hysterical? You're looking at yourself, you're looking at him, you're trying to behave according to gamer to get his trust, and you're trying to analyze who is this guy. Yeah. So he once I was doing the examination and he bit my hand and I thought he will apologize. He didn't. And my hand was hurting. And I was like, it's paining. He said, yeah, I'm not interested. I want to go. So it's like, you understand now what's happening. I'm trying to see, should I really place implant on this? Anyway, now the reasons to place implant for him. He has difficulty in eating. He cannot eat anymore. Aesthetically, phonetically, he is very upset with his looks, with his children are upset with his looks, and he cannot pronounce. Bone availability is sufficient, just barely sufficient to do all and four. So there is bone for all and four. This is a reason to do or not to do? To do. Patient demands fixed restoration, which is also possible to do. Financial limitations he has, but all and four is affordable for the patient. So putting this as a reasons to do implant. So I decided to become an ideal dentist according to Gamer, and this is the part I wanted to say. After listening to 3 of you, you have to understand the patient cannot be 100% hysterical or 100% exacting or 100% philosophical. They can be 5% philosophical, they can be 20% exacting, 50% indifferent, and 10% hysterical, or the reverse. You can change the numbers. You understand? So if you get little shouting, but when you talk logic, they listen, that means their philosophical is also there. They send you a flower next day, that means there is some, but also there is hysteric, because as soon as they see the handpiece, they hit their head against the wall. You understand? So don't expect this to be one and that's it. There is always a mixture of these 4. For example, his story was mixture of more than one character, but you have to analyze the percentage. Okay, let's go to bipolar hysterical. but this will take us a long process.
We have one.
No, but my point is, don't think a patient is 100% one of the four. That's it. That's my. So I started ideal. I explained to the son, I explained to the father, I did my best. Then, as the patient was very indifferent to everything I say, and you are a dentist like any dentist, he told me, what does it matter which dentist I go to? I will listen and follow some of your instruction if I agree, and I will not listen to all your instructions, he said, the patient, to me. So, to me, based on this conversation, it was, I'm trying to still know if this will work, if I do all this treatment. Unfortunately, I also slowly became indifferent. I couldn't keep up my ideal dentist to the end because he kept on giving me, why should I continue with you? Like this. So I was trying not to be, but the only way I can tell you frankly, I felt I'm not behaving like I would behave to a philosophical patient. I felt it in myself, which is not what Gamer is telling us to do, because this way I will lose the trust which will make him better, which will make him philosophical. So I'm the one now losing the battle because of my way of looking at the responding the patient. So I started the treatment. We placed the lower all in 4. We took the impression, immediate loading, because we promised the patient. I want you to pay attention to the tongue. See? He doesn't have to do that, but he wants to do that. He wants to touch everything in the mouth. On top of that, he bites the hand every time he. So we have this caliper. We have the lady. I don't know if you heard her. She's saying, "Please don't. Please open. Please open." In Arabic, she's trying to calm him down. And let us see quickly how did it go. So with 1230 extraction, you saw the teeth. This is the instrument to give you lateral and then 45 degrees. And this is the paneling pin for the front ones. This is the Noble kit we used at that time. 4.3 by 13 was the recommended by Paolo Maulo. That's how we started. And we are trying to place the distal one in 45 degrees. And these are the 4.3 by 13. According to Paolo Maulo, 13 is the ideal length. This is the torque at 45, between 35 and 45. This is a drill to shape the bone around the implant, so there is no pressure. Thomas also agrees with this. We will talk about Thomas a lot during this coming weeks. This is the implant in place. The speed is 20 and the torque was almost 70, which means we can do immediate loading. We are checking the 45 angulation in the back teeth using this instrument, and the 4 implants are being placed. 35 we reached, and that's good enough. Now we have to place the multi-unit abutment. So the back one is 30 degree to match the front, which is straight. So the front is a straight multi-unit and the back one is a 30 degree. I'm just trying to show you the holes because some people don't understand why multi-unit is special, because it has one hole here and another hole there. This is the impression for the immediate loading. These are the parts of the impression. This is the implant. This is the multi-unit. This is the impression post. We inject the impression material around, and then we have a tray, and these are penetrated above the tray. See, it's sticking out. This is a transparent sheet on top. See, sticking out.
This is a very early case in your career.
Yes, 2016. This is when I attended Paulo Maulo's lectures, and I wanted to copy him. So this is, we poured it and we put the healing abutment till we're waiting for this to set in the lab. I mean, in our clinic, we are doing the modification of the previously made denture. This is the cylinders, and this is in the mouth. And that's it. I'm showing you how we glued it in the mouth and how we are trying to fill this area now after picking it up from the mouth. And this is how we could give it to the patient on the same day. These areas have to be filled with self-cure acrylic or flowable composite, whichever you want. This is from inside, and the Teflon is to make sure no acrylic goes inside. And we seal the hole with the Teflon and flowable composite, so food will not go, and the patient goes home with this. This is the concept of all-on-4. And this is the mandibular one for this visit. Sorry. This is the mandibular one for this visit. Now, after this, let us continue. This is the mandibular implants. For the maxillary, I was not as lucky. I couldn't get 35 here. And by the time I looked back and came, the patient bit, and all this bone broke, and the implant fell on the floor. And I'm looking at the floor, and the son is saying, "You promised immediate loading. You have to give us immediate loading." And there is this implant without the bone is on the floor. So finally, after waiting 3 months and re-implant, and I could give the patient all-on-4 maxilla and all-on-4 on the mandible. From here to that. And you can see from the figure of the face what kind of a character you're dealing with. And finally the patient went. So the patient, that was 2016. In Corona, he passed away. So for 5 years, he actually had teeth to eat with. Now the question is here. Should I or shouldn't I had treated this patient with dental implants? Now you raise your hand. The people who think I should have for 5 years, raise, and people who think I shouldn't have. And is it different from your hand after seeing the case? Like you didn't raise the hand, now you raised. Those people raised and now they didn't raise. It's very strange. What reaction? Of course he was happy. He ate for 5 years before he died in Corona.
Quality of life.
No, but after you saw what we went through, you think we should I have had placed, or I should have sent the patient home? Raise your hand, don't say yes. So people who think I shouldn't have, only one person think. You also think I should not have done because it's not ETK. He's not raising his hand. Okay, so case 2. Case 2 is very interesting. So this girl comes to me at age 12. So now we have this scenario. She doesn't want to go to school. She doesn't want to go anywhere. She locked herself in her bedroom. And the father is holding my hand. Suhail, please, this is your daughter. Don't treat her like a patient. This is your daughter. What will you do for your own daughter? Okay, so this is a very painful scenario when you become a father of somebody who's like not your own kid, but you were given the responsibility to act like one. Again, Uh, the, okay, I'll show the slide. So we took the impression in 2013 for the Maryland, and we did the bone grafting. You can see the bone graft here, filled the socket, and the Maryland was placed. But it keeps on every few months falling, and the patient doesn't want to come back to re-cement it. She doesn't want to do anything. The patient is now, she was 13, this is 14, 15. For 2 years, this continued re-cementing till patient 15. She doesn't want to come to treat because she knows she has to wait 5 years, and she waited 2 years. She doesn't want to come to me for Maryland cementation. She doesn't want anything. So now the question is, should I, remember now the patient is 15. Should I or shouldn't I treat this patient with dental implant? Raise your hand if you think I should. 1. With some awareness. So only 1%, 2%, 3%, 4%, 5%, almost, we are not even 50%. So 35% think we should place an implant. And the rest say, she's depressed. So what happened to the mirror? You're supposed to look at...
Because she's 15. She still didn't.
Yeah, but what happened to the mirror? What kind of trust you're building? According to Gamer, what is your character when you say, are you indifferent? You're resistant. No, the ones who are not raising their hand, what character are you taking out of the 5? Indifferent, resistant, ideal?
Reluctant?
Ideal, and you're not raising your hand.
Yes, no. I come from another solution. Refusing to do
No,
it.
that's either indifferent or reluctant. At least say reluctant. Don't say ideal.
Because ideally, she should be.
Patient has depression. What if she commits suicide? Which one is better? You know what's a depression? It leads to suicide.
He doesn't
Bullying in
know
school.
what meaning of idea.
What? I mean, Maryland Bridge will solve the
He
problem.
thinks idea.
Maryland fell 5 times. She doesn't want to even get the Maryland. She's reluctant. Halim, what did? So what character you are taking? Huh? Reluctant. Resistant. You don't want even me to place now. Resistant means nobody should place. I'm not placing. Even Suhail should not place. That is resisting.
Yeah.
Oh my God. Okay.
Doctor, why you don't do something like an SX or RPD? Why implant?
Because she doesn't want removable. She's already crossed that. She's depressed. She doesn't want to see me. So after that, I started acting like ideal dentist. I started my research. And remember, the patient is philosophical. And the father is saying, this is your daughter. It's not, whatever you do, I will not question you. Legal, illegal. I said it's illegal. Illegal. Do illegal. It's your daughter. Do whatever you want. I will not interfere in your decision because I trust you. See the trust. So because of that philosophical patient, father, no, the child doesn't want to see me. The child is like, who are you? You give me something falling 5 times? So I started reading all the articles which can give me the final decision making on when to place the implant. Now this is the most referred to article, and it says do not trust this for implant placement in the article itself. So this is not approved to be for implants. I started reading all possible articles. The only thing I got was puberty should be passed. So I called the mother. Tell me, is she crossed puberty? She said yes. Then the other Yeah, so the reasons to place and the reason not to place. Reasons to abort mission, since the substantial amount of growth still remains at age 15, this is an inappropriate time to place an implant. That's why half of you, more than half of you, did not raise your hand. Reasons to place an implant, 15th of July 2014, re-cementation repeated 5 times. Patient does not want to go to school anymore. Bone resorption is happening. I'm losing the bone I placed 2 years ago. Depression is continuing. So if I wait, I need the block graft. I need 6 months and then cost and then, so, and also depression. So I looked at TAD. TAD is a temporary anchorage device that orthodontists place to move teeth or to make something temporary till the final growth is found, and it's working. So the problem with TAD, it's not titanium. It doesn't osseointegrate. So if I put something which is not osseointegrating, how it's going to keep the bone? The bone at the neck will resorb because of the mobility. So if TAD is legally allowed, then what can I do to make it legally allowed but it integrates? So I decided in the literature to see what can I do which actually can have a mechanical stimulation to the bone. All of them came back to the narrowest possible implant which is resistant to fracture, after making sure that the height of the patient for the last 6 months did not grow taller. So puberty is there. 6 months we are checking the height. She did not grow taller. Alright, so because the patient was philosophical, I was trying to be ideal and submitting seriously to this case 100%. So what I decided to do, I decided to place the implant with the minimum diameter available at that time, with bone expansion, without any drilling because the bone was resorbing. 3.2 by 13 millimeter was used. This implant has never had a history of fracture. I took a periapical X-ray at the time of loading, before loading also. There is a formula that how you can check if the growth is affecting the bone loss. So what I did, every 3 months I would take a periapical, May, June, July, every 3 months I will take a periapical X-ray, but what kind of periapical X-ray? What is that photo? There is a photo. Yes, there is a photo somewhere. Okay, it's not here. I took a bite registration in the periapical holder. So every time she will bite in the same position, and the periapical X-ray will be same angle. So this is the position of the implant, which is screw retained. So we spend time to make sure that the bone is not labially compromised. We stay palatal, not too palatal, ideal. And this is the treatment plan, and this is the actual position of the gum and the tooth at the time of restoration. And this is the device I told you. So every time we take a periapical, we don't have to worry about angulation which makes the bone not to show. What are we afraid of? No. Growth of the neighboring, and the implant will stay in. So every 3 months, then every 6 months, then every 1 year. We are taking periapical. This is the position of the teeth. You can see the crossbite. So this was the photos that we are taking every 6 months. She's not growing any taller since that day. So again, going back to the, so this is at the time before orthodontic treatment. Then during orthodontic treatment, we wanted to cross bite correction, and then this is after everything is over. So the bone level during all the phases stayed the same. So that means the teeth did not grow because she didn't grow taller. So this is all the dates that we did. 2013, implant at age 15, ortho 1.5 years it took to do the orthodontic treatment, then 9 years of follow-up, and this is during ortho, this is during ortho. After ortho, you can see little bit of space is created because the neighboring teeth, which ceramic can be always added with a new crown, but the margin is staying the same. That means the bone graft was successful. Now the patient has been using this for 12 years. So she was 12. That means she was born in 2001. So 2025, she is 24 years old, right? So again, I want you to raise your hand thinking, should I have or shouldn't I have? You think after you saw, because 50% of you were not convinced to more, 60% of you were not convinced to place, and you were reluctant. Now, after you saw the result, and 12 years have passed, and you saw the result after 12 years, now what do you think? Should I have done it 12 years ago, or I should not have? Raise your hand. I want to see the percentage. Okay. All right. Now, I have a surprise for you. I'm going to call her. I hope she answers. What should I ask? How is your implant?
Hello.
Hello.
You have the whole class.
أخت مريم.
Hey.
إيه حبيت أسألك على الزراعة.
تفضل.
الحين تعرفين تقريبا 12 سنة من وانت زرعتي صح؟
Hey.
ممكن تخبرينا التفاصيل كيف تاكلين وياه؟ في أي شيء يزعج؟
هو ما في شيء يزعجني، بس مثل ما قلت العصر ان الاكل يدخل بين الزراعة والضرس الثاني.
من متى هذا الكلام؟
يمكن سنة بس، مو بينا من زمان.
زين، يوم قبل 12 سنة وانت كنتي 15، شو كنتي موافقة على أن نسوي الزراعة؟ كنتي خايفة؟ شو كان تتذكرين كيف كان الوضع؟
ايه اذكر كنت عادي يعني موافقة، بس كنت خايفة شوي من ناحية الجراحة.
زين. بخصوص المراجعات، انت هل كل سنة بتين وتراجعيننا؟
ايه عادي.
ايوه ان شاء الله.
ان شاء الله.
Any questions؟ خلاص، أنا بس حبيت يعني أتأكد أن أنت الحين موافقة أن هذا كان أحسن خيار صح؟
إيه.
أيوة خلاص، شكرا، وإن شاء الله بيتصلون فيك من العيادة.
إن شاء الله.
شكرا. So she definitely she cannot say I'm ندمانة. Come on. The people who don't speak Arabic, she has because of orthodontics, she lost probably her retainer or something. the lateral has moved. So there is a gap. So one is either we have to give her Essex to bring it back, or if it's very minor, we have to send the crown to add a thin layer of ceramic. Depends when I see her. The point is, if they come every year, see, this is 1 year ago this has happened, and she didn't come. If they come every year, we won't allow. They will tell us, I lost my retainer. We make quickly one retainer. Instead of waiting 1 year, now we have to pull. But this orthodontic treatment relapse, in the literature, I think it's 60%, 50% or something if you don't have your retainer. Something in the literature, or even more. I forgot the exact percentage of chance. If you don't have a retainer, the chance of relapse is very high. And if you didn't, then it's extremely high. 6 months. Then we wait 6 months more. Because if she's growing taller, the implant will stay and the teeth, yes, will come lower. So then the gingival margin, yes, then you need to make a longer teeth, and it will from FP1. I don't know if you watched where I placed the implant, exactly where it should be. So imagine if this is lower, what will happen to, according to Dennis Tarnow, 1992, papilla, how will the papilla be stabilized? Based on the bone level. So if the teeth is coming down and the implant is deeper, the pocket is deeper, the papilla will go higher, and then the papilla will go. And then you have to make this tooth FP2. Either you put pink or you just make it long white. So this central will be shorter when she smiles, and this central will be longer till she stops growing. Yeah. So that's why we don't touch till this 6 months is solved. Yeah. All right, let's go to the third case till we have time. Now, can you kindly read? All right, so now we are looking at this tooth. Did I press it twice? All right, so we're looking at this tooth, right? And we're looking at this tooth. So, this tooth is hopeless. This tooth we try to do deep scaling because the mobility is only 2. So slightly out of occlusion to hopefully stabilize it with curettage and deep cleaning for full. See the subgingival calculus? Yeah, you see here? So all this was cleaned, and periodontist took care of full mouth rehabilitation in terms of cleaning. And then this was hopeless because mobility 3. Now the question is 4, 7. Yeah, this one was not as bad as this one. So the patient was only referring to this. Now the reasons to abort mission is, you can tell, is this patient never came on time. He was 100% indifferent. He was okay if I don't even extract. He said, if you don't want to extract, leave it, let it fall. I said, there is pocket here, so let it be. You go for this one, no, I'm busy. So like it wasn't easy. So I had to call the wife, tell him, please tell your husband this is important. So the wife will say, he doesn't even listen to me. Exactly. Then the wife will call the sister, and I will call the sister, his sister. The sister will tell him, please go to Suhail. He's good. So it was very much of, yeah. For example, one of the tricks was his wife came for a treatment, And we told him, you have to come and pay for your wife. So he came to pay, and we did the treatment. So that you understand? You don't understand? Because he came, we said, sit down. He said, okay, I'll sit down. We'll do the treatment. Okay, do. But he won't come for a treatment. But he will come to pay for his wife. You understand? So we tried these techniques. Every time we have to bring his son for something, then bring his wife for something. So anyway, so the reasons to abort mission was because he was indifferent. Of course, my character was, I really wanted to do this case because it was very challenging. So I was still ideal. I did the cleaning. He did not insult me to make me indifferent. I'm not saying if somebody insults me, I should become indifferent. I still should remain ideal and submissive. But this case was not at all making me lose my passion to do this case, no matter what. Anyway I go, I wanted to do this case. So we did the cleaning, we did the thing. So what do you think now? Should I or shouldn't I? Why I should? Reasons to place. What are the reasons? The teeth will shift, and if he is indifferent, and if I'm not taking care of him, he will not take care of him. So again, I've become a ideal, like taking role of a parent, kind of an ideal parent. Yeah. So that's the reason, because I'm afraid he will not trust anybody if he doesn't come to me. That's another reason to abort mission, not to do implant. This is already root canal. This is root canal probably, and a crown and a bridge. That's another option, yeah, which I don't do normally bridge anymore because I thought I can do a nice bone grafting and implant. I will use this bone to get stability and I fill the gap. So people who think I should do, raise your hand. Except the periodontist, everybody thinks. You also think I shouldn't. You, I shouldn't. You, I shouldn't. No. And you are never part of this class anyway.
I said yes.
Yes? But your hand is, yeah? Alright. So going back to the exacting and the philosophical, this is from the internet, which is not making any help to me to understand. So I changed this to another photograph. This is easier.
Yes, okay. We should cut this from you.
Yeah, please cut this. So what I wanted to understand from this case, if he's indifferent, right, at least I can take care of the periodontal problem, which he's mainly suffering from. So my job is to make sure this is healthy. So my implant will work. Yeah? So because he comes like this, that means I have to, without him coming, it's very difficult, but I have to keep finding way to maintain his periodontal health. So this is the story. This is already published and you have it in your data. 2012, he reported. And because he came 3 years after implant placement, see how indifferent? 3 years after implant placement, he came. This much he did not care, he forgot, or he did not. 3 years, not 3 months. So the Hounsfield unit was 14, 20, and 17 around the area. So, of course, it's time to extract the implant and do bone grafting. But because I was trying to make this survive, we did progressive loading. For this case, we placed the acrylic tooth 3 millimeter short of occlusion, called them after 3 months. The number went to 44. Now, there is a secret here. Not a secret, there is a catch. If there is no buccal bone and you do progressive loading, the number will not increase. only if there is buccal, palatal, lingual, mesial, distal bone, and your ISQ is low, only then the number will increase. So you have to take a CBCT to check if there is surrounding bone. Then you invest in progressive loading, temporary crown, abutment, all that, lab fee, this fee, that fee. Yeah. Otherwise, don't give hope to the patient and then pay, or the patient pays, and then after 3 months the implant is out. So don't mix up all 14, 17 Hounsfield ISQ, always become 44 and 77 and finally 80.
What is the minimum? If
Minimum.
we're talking lingual buccal,
There should be bone.
okay.
If there is no bone, it is not going to work. Don't open and put bone graft. Remove the implant. Huh? At least surrounded.
But it is not mobile.
Even if it's no buccal bone and you have 14 or 17 Hounsfield unit, ISQ, by putting load, this bone will disappear and the implant will fall after 6 months or 1 year or 2 years. So don't open and put bone graft on a 17 Hounsfield ISQ. It will not increase. If the bone is there but it's not dense,
Not 2 millimeters.
even less than 2 millimeters. If the bone is there holding the implant, but it's soft, you can do progressive loading, vitamin D, mouthwash, you can do all those things, and the density will, you can see the density has more than what I expect. Of course, this took years to get to 80, but my point is the number from here kept on going. This was at the time of evaluation, which was 17. Slowly you can see the bone has formed, and even you can see radio opaque dense bone at the by the way, this is still surviving. I'm not saying it's fantastic, but it's surviving till now. I saw him last year. He lives in Australia now. This is when it became 80. He lives in Australia. I don't have any hold of him. He was passing by. His wife called to say hello. Where is your husband? What do you want? I have to see him. I have an article on him. So how to trick? I said, tell him that I really need to give him a gift or something. So he came to receive his gift. I sat him down. I checked. I removed his crown. I saw some calculus. I polished it, put it in chlorhexidine, because it imbibes. People like this, they have always calculus around. So I polished it with this disc, ceramic polishing disc, to remove any microbes which might, put it in chlorhexidine, wash it, and then put it back. Hopefully it will, because this was after maybe 7 years. Last year I saw him.
Do you remember the width of the implant? Yeah, I see you put a very wide implant.
Yeah, it's a 5, I think. It's a 5 millimeter. If I remember, it was 5. So after 7 years, we checked, and then last year again, I checked. This was 2012, was it? 9? No, 2009. So this is 7-year periapical. I have an X-ray 2024 also. Same. No difference here. Same. Not better, not worse. I even took the Hounsfield unit, the ISQ, still close to 80. So the Hounsfield unit did not go down. Only my worry was that all this area should not have bacteria to live in. So the reason I'm putting this, yes, no, he didn't change. He didn't even come to see me. I found a trick through his wife to see him. And when he came, and I told him, I want to check your teeth, he said, fine. But he didn't come for his teeth. But he was in the clinic because I don't know, I said I have a gift for you, I have something for your son from my son, something I made up, which I give him. But it was not the reason, the dental reason was not the, no, he listens to, he comes for proper, he's like a very ethically oriented person, very ethical, but not giving attention to his teeth.
Once the visit is finished, it's done.
Yeah, it's difficult to see him unless there is a reason, not dental. Dental is not a good reason. That's what, now you saw this, and you know he did not change. So now I will ask you, after you saw the case, you think I did the right thing by placing an implant 2009 or not? If you think I did the right thing, raise your hand. Okay, so now that's the answer. The answer is, this is, no, no, but again we go back to the theory of let them and let me. Let them do what they are indifferent, and I am trying to be ideal. So I decide how I want to behave. Of course, maybe in 2025 I get more signatures in terms of legal, if it fails, who's responsible. But the patient is, I cannot change him. He will be indifferent, and he stayed indifferent 2009 till 2024. How many years? 15? 15 years, he's still indifferent.
Okay, but for you, is this a win or a loss?
There is no win or loss. I stayed ideal in this case. I didn't become, you remember the first case I became indifferent? This case, whenever I get a chance to see him, I want to see, I want to check, I want to clean, I want to do my best. I want to stay ideal according to Gamer to get his trust. When I have his trust, things worked. So this is not all the cases. We have we have periodontal chronic patients who have failure, and we remove them. Either we place or we stop placing. We have them, but my point is, because I got his trust somehow, right? He stayed indifferent, but he came back. When I called him, somehow he came. And it worked. So the moral of my story is, if I'm ideal, I can get the patient's trust, even though he is indifferent. That's the moral of this case, to me. Now, why it worked? Maybe because there was bone and we did progressive loading. Maybe that was the reason. There was no other.
This is my second question. Is there a difference between the low quality bone of osseointegration give the 12 reading and the fiber healing?
This is not fiber.
Yes.
This
How
is
I will differentiate during the decision making? It's not fiber. I will make a progressive
movement, mobility. With fiber, there is a slight mobility, little bit. This was not mobile, not mobile.
by percussion sound,
Yes, yeah. But this 17 is very low, very low. 17 is very low.
What is it possible to open a flap and put bone graft
It will not work if there is no 2 millimeter of buccal bone.
if there is a 2 millimeter of buccal bone?
And why you open?
I mean, sometimes I need to, like, there is some resorption.
No, but by putting bone on top of the bone, your ISQ value will not go up. The problem is the cells, the oven bone, still they are oven bone. In 3 years, they were not stimulated. He didn't show up. So because of lack of stimulation, the bone became oven and stayed oven. Oven is not the rice. Oven. Oven. Yeah, oven. So by doing this progressive, you make the oven bone cancellous, hopefully then cortical, yeah, or laminate at least. So that was what we tried. I definitely today, we have enough evidence to always use platforms. I mean, with this Thomas theory now, we are hopefully all of us should memorize his theory. There should not be cases without platforms. Thomas has I gave this, it's a 1 hour presentation. We will do it again. I want to call everybody because today I asked one of the doctors, because during uncovery, she made the incision in the labial area and she put a healing abutment. So patient came after 1 week, lateral incisor, the gum is higher than the other side. So she wanted to take impression. I stopped her. I said, how you will take impression? She said, yeah, 1 week I put the healing, I will take impression. I said, but the gum is higher than this side. Your crown will look longer, lateral will show, lady. No, it's a male actually, but it will show. He said, she said, yeah, but what? I said, Thomas, you have to do this. She said, okay, can I write in the job order for the lab to follow Thomas theory? I said, do you know Thomas theory? She said, no. I said, how you expect the lab to know Thomas theory and you as a surgeon who don't know Thomas theory? So the point is, it's not one thing. It's like 5 things you have to follow. I explained it during EDIC. I will explain it again. I think here also I explained it once, but if we can invite more of the doctors next week, we finish this theory because it's affecting us every day in the aesthetic zone. The incision in the anterior maxillary area should always predict the gum before the impression. I'm not saying palatal or buccal or mesial, wherever you're doing it. It should predict where the gum will be after 1 week. You cannot just make an incision and it's uncovering. No. It has to be planned in a way that after 1 week, the gum will look exactly or even big more than the other side. That's where you make the incision, according to the future gum. Yeah, it's very important. So what do you think the solution will be now? One is a graft, easier than graft. Yeah, remove the healing, put a cover screw, let the gum heal. Either 3 weeks is ideal, at least 2 weeks. Once the gum is formed, you do a pedicle flap, not from the palate, from just, what is it called? No, not that. No, from the palate you roll it. You take split thickness and then you modified roll technique. If there is enough, modified roll technique will do, because she needs 1.5 millimeter. That's all she needs. That's what we remove the healing, put a cover screw, wait 21 days. The gum.
After 21 days, you can make modified.
Yes, and then you wait again. Then you make an impression. This is delayed 21 days because the doctor decided crystal incision, finished. Easy, no? It's easy. Crystal is easy. But didn't think, okay, what will this crystal do to the gum? Crystally, if you have 3 millimeter of gingiva, okay, and when you do crystal incision and you open your flap, okay, and you put your healing, and you see the other side is longer, you have to remove your healing. You cannot send the patient home for 1 week and now the epithelium is already formed. It's worse now, but at least better than making the impression and making a FP2. All right. A mistake that changed history. What mistake changed history? According to Columbus, he wanted to go to find India, and he went to the US. Half of the world is 24,300. Now, I want to show you some other mistakes which actually helped us. One is there is a lot of articles that is talking about the relationship between, this is still the previous case, the relationship between Hostel and torque during implant placement. Now, in this case, this is the patient, by the way, that we did the progressive loading. If, let's see, the position is either this moved during this 3 years, because I don't think I placed the implant so distal. Most probably this has moved mesially during this 3 years. The problem is if I pay attention to the ISQ value related to the torque, then I should have removed this implant when it's 17, correct? Because in the articles, they show you that, let me find the article for you. The article, where is that? There are many articles which says ISQ and torque are linked. If the torque is low, the ISQ low. If the ISQ low, the torque should be low. So if the ISQ is 17, so what is the torque? Very low. So remove the implant, correct? So this was one of the, like Columbus went to the India and he landed up, it was a big mistake. This mistake we suffer, I think this is the article. Yeah, the article says there is a relationship between bone density and implant stability. This has caused thousands of people to believe that these two are related because this article is published. Not one, many. We should not believe this, because if that was true, then this implant should have failed. So what we know from my cases, that if this is the Newton centimeter and this is the ISQ, there is no relationship. If it's high, in another case it is low. So when we did the statistical analysis, this is tooth number, we found that there is no relationship at all. The ISQ can be high, the torque is low. The torque can be high, the ISQ can be low. So because we did this for 30 cases and we had different readings, so this is only 10 of them, maybe 50 cases. We have the data. We have a statistical analysis. There is no relationship between torque and ISQ at the time of implant placement. Unfortunately, it's one of those mistakes that the whole world is following, but it's impossible to delete now because it's already published. Yes, so this one, we did the torque, we placed the implant in the ideal position. We wrote the torque. Then we checked the ISQ, we got a number, okay? Then we checked it on 50 cases. We found there is no relationship. This can be high, this can be low. This can be equal. See, some cases are almost equal. Some cases are from 30 to 70. What kind of relationship is this? If this goes high, this should go high, right? If it's a relationship. And if this goes low, this should go low. Correct or not? Why in some cases it's the same, some cases it's high, some cases it's very low, extremely low? That means no relationship, no pattern. That means no relationship. Okay? It's always higher, but we see 50, 62, 50, 69. What does it mean?
Why you use torque in 70?
Huh?
70, you use torque.
Sometime we cannot go back also. We put it, it's tight bone, it gets stuck.
You go on, keep it.
No, you leave it, finished. I mean, it's not ideal is 45, but there are times, see, it went up. 86, 70, 70, 70, 70, 75.
37.
Huh? 37.
33 times comes.
See, the difference is 12, then 19, then 5, then 0, then 40, 35, 30, 49, 60. Do you find any relationship in these numbers? It should be equal, no? The difference should be equal. If you want this to be related, this number should be at least near, if not equal. Something like near each other, right? So my point is, one article says it's not related, one article it says it's 100% related. So I think that, and this is our work, it shows they are not related. In our study, it's not related at all. Okay? So going back to the case, we are showing you how we did the provisional and then how we did the final in occlusion. No, he listens to the he comes for proper, he's like a very ethically oriented person, very ethical, but not giving attention to his teeth.
Once the visit is finished,
Yeah, it's difficult to see him unless there is a reason, not dental. Dental is not a good reason.
Doctor, I have two questions.
Yes.
If you have patient indifferent and he's chronic periodontitis patient,
Like this.
like this, you will go forward for doing implant for him even if you fail to change him to cooperative patient.
That's what. Now you saw this. And you know he did not change.
Yes.
So now I will ask you, after you saw the case, you think I did the right thing by placing an implant 2009 or not? If you think I did the right thing, raise your hand. Okay, so now that's the answer. The answer is
Successful case.
this
Can
is
I build
no.
successful case on future decision making?
No, but again we go back to the theory of let them and let me. Let them do what they are indifferent and I am trying to be ideal. So I decide how I want to behave. Of course, maybe in 2025 I get more signatures in terms of legal, if it fails, who's responsible. But the patient is, I cannot change him. He will be indifferent and he stayed indifferent 2009 till 2024. How many years? 15? 15 years he's still indifferent.
Okay, but for you, is this a win or a loss?
There is no win or loss. I stayed ideal in this case. I didn't become, you remember the first case I became indifferent? This case, whenever I get a chance to see him, I want to see, I want to check, I want to clean, I want to do my best. I want to stay ideal according to Gamer to get his trust. When I have his trust, things worked. So this is not all the cases. We have we have periodontal chronic patients who have failure, and we remove them. Either we place or we stop placing. We have them, but my point is, because I got his trust somehow, right? He stayed indifferent, but he came back. When I called him, somehow he came. And it worked. So the moral of my story is, if I'm ideal, I can get the patient's trust, even though he is indifferent. That's the moral of this case, to me. Now, why it worked? Maybe because there was bone and we did progressive loading. Maybe that was the reason. There was no other.
This is my second question. Is there a difference between the low quality bone of osseointegration give the 12 reading and the fiber healing?
This is not fiber.
Yes.
This
How
is
I will differentiate during the decision making? It's not fiber. I will make a progressive
mobility. With fiber, there is a slight mobility, little bit. This was not mobile, not mobile.
By percussion sound,
Yes, yeah. But this 17 is very low, very low. 17 is very low.
What is it possible to open a flap and put bone graft
It will not work if there is no 2 millimeter of buccal bone.
if there is a
And why you open?
I mean, sometimes I need to, like, there is some resorption.
No, but by putting bone on top of the bone, your ISQ value will not go up. The problem is the cells, the oven bone, still they are oven bone. In 3 years, they were not stimulated. He didn't show up. So because of lack of stimulation, the bone became oven and stayed oven. Oven is not the rice problem. Oven. Yeah, oven. So by doing this progressive, you make the oven bone cancellous, hopefully then cortical, yeah, or laminate at least. So that was what we tried. I definitely today, we have enough evidence to always use platforms. I mean, with this Thomas theory now, we are hopefully all of us should memorize his theory. There should not be cases without platforms. Like, that's it. It's a must now. It's like, that's it.
What's the Thomas?
Thomas has I gave this, it's a 1 hour presentation. We will do it again. I want to call everybody because today I asked one of the doctors, because during uncovery, she made the incision in the labial area and she put a healing abutment. So patient came after 1 week, lateral incisor, the gum is higher than the other side. So she wanted to take impression. I stopped her. I said, how you will take impression? She said, yeah, 1 week I put the healing, I will take impression. I said, but the gum is higher than this side. Your crown will look longer, lateral will show, lady, no, it's a male actually, but it will show. He said, she said, yeah, but what? I said, Thomas, you have to do this. She said, okay, can I write in the job order for the lab to follow Thomas theory? I said, do you know Thomas theory? She said, no. I said, how you expect the lab to know Thomas theory and you as a surgeon who don't know Thomas theory? So the point is, it's not one thing. It's like 5 things you have to follow. I explained it during EDIC. I will explain it again. I think here also I explained it once, but if we can invite more of the doctors next week, we finish this theory because it's affecting us every day in the aesthetic zone. The incision in the anterior maxillary area should always predict the gum before the impression. I'm not saying palatal or buccal or mesial, wherever you're doing it. It should predict where the gum will be after 1 week. You cannot just make an incision and it's uncovering. No. It has to be planned in a way that after 1 week, the gum will look exactly or even big more than the other side. That's where you make the incision, according to the future gum. Yeah, it's very important. So what do you think the solution will be now? One is a graft, easier than graft. Yeah, remove the healing, put a cover screw, let the gum heal. Either 3 weeks is ideal, at least 2 weeks. Once the gum is formed, you do a pedicle flap, not from the palate, from just, what is it called? No, not no, from the palate you roll it. You take split thickness and then you modified roll technique. If there is enough, modified roll technique will do, because she needs 1.5 millimeter. That's all she needs. So
Sorry, there is a hole around the healing.
that's what we remove the healing, put a cover screw, wait 21 days. The gum,
After 21 days, you can make modified.
yes, and then you wait again. Then you make an impression. This is delayed 21 days because the doctor decided crystal incision, finished, easy, no? It's easy. Crystal is easy, but didn't think, okay, what will this crystal do to the gum?
But crystal only if it's at the same, originally at the same level.
Crystally, if you have 3 millimeter of gingiva, okay, and when you do crystal incision and you open your flap, okay, and you put your healing and you see the other side is longer, you have to remove your healing. You cannot send the patient home for 1 week and now the epithelium is already formed. It's worse now, but at least better than making the impression and making a FP2. All right, a mistake that changed history. What mistake changed history? According to Columbus, he wanted to go to find India, and he went to the US. Half of the world is 24,300. Now, I want to show you some other mistakes which actually helped us. One is there is a lot of articles that is talking about the relationship between, this is still the previous case, the relationship between Ostel and torque during implant placement. Now, in this case, this is the patient, by the way, that we did the progressive loading. If, let's see, the position is either this moved during this 3 years, because I don't think I placed the implant so distal. Most probably this has moved mesially during this 3 years. The problem is, if I pay attention to the ISQ value related to the torque, then I should have removed this implant when it's 17, correct? Because in the articles, they show you that, let me find the article for you. The article, where is that? There are many articles which says ISQ and torque are linked. If the torque is low, the ISQ low. If the ISQ low, the torque should be low. So if the ISQ is 17, so what is the torque? Very low. So remove the implant, correct? So this was one of the, like Columbus went to the India and he landed up, it was a big mistake. This mistake we suffer, I think this is the article. Yeah, the article says there is a relationship between bone density and implant stability. This has caused thousands of people to believe that these two are related because this article is published. Not one, many. We should not believe this, because if that was true, then this implant should have failed. So what we know from my cases, that if this is the Newton centimeter and this is the ISQ, there is no relationship. If it's high, in another case it is low. So when we did the statistical analysis, this is tooth number, we found there is no relationship at all. The ISQ can be high, the torque is low. The torque can be high, the ISQ can be low. So because we did this for 30 cases and we had different readings, so this is only 10 of them, maybe 50 cases. We have the data. We have a statistical analysis. There is no relationship between torque and ISQ at the time of implant placement. Unfortunately, it's one of those mistakes that the whole world is following, but it's impossible to delete now because it's already published.
May there be a relationship between ISQ and bone density?
Yeah, could be. But how you check bone density? You mean Hounsfield unit? Could be. I don't know, but definitely the Newton
I mean,
centimeter.
it's more likely that
Yes,
this kind of relationship instead of
yes, yes.
Is this time of surgery or after surgery?
No, after, how can you check the torque? This is time of surgery only. After, you cannot change the check the torque.
There is a way to check if implant fail or not by torque less than 20. It's all
No. See, of course, I understand that test.
but you cannot check when you move.
Yes. So this one, we did the torque. We placed the implant in the ideal position. We wrote the torque. Then we checked the ISQ. We got a number. Okay? Then we checked it on 50 cases. We found there is no relationship. This can be high, this can be low. This can be equal. See, some cases are almost equal. Some cases are from 30 to 70. What kind of relationship is this? If this goes high, this should go high, right? If it's a relationship. And if this goes low, this should go low. Correct or not? Why in some cases it's the same, some cases it's high, some cases it's very low, extremely low. That means no relationship. Can you relate anything?
ISQ is always higher than.
The ISQ is always higher?
Sometimes
Always higher than the torque.
Yeah, but is there a relationship? That's my point. When it can be equal and it can be more than twice, how?
There is no pattern.
No pattern, that means no relationship. Okay? It's always higher, but with, see, 50, 62, 50, 69. What does it mean?
Why you use torque in 70?
Huh?
70, you use torque.
Sometime we cannot go back also. We put it, it's tight bone, it gets stuck.
You go on, keep it.
No, you leave it, finished. I mean, it's not ideal is 45, but there are times, see, it went up 86, 70, 70, 70, 70, 75.
30, 70.
Huh? 37.
33 times comes.
See, the difference is 12, then 19, then 5, then 0, then 14, 35, 30, 49, 60. Do you find any relationship in these numbers? It should be equal, no? The difference should be equal. If you want this to be related, this number should be at least near, if not equal. Something like near each other, right?
I think as doctor says, sometimes the bone density is different reading.
Okay, but is it related to the torque? Yeah, that's my point. So my point is, one article says it's not related, one article it says it's 100% related. So I think that this is our work. It shows they are not related. In our study, it's not related at all. Okay, so going back to the case, we are showing you how we did the provisional and then how we did the final in occlusion. To say they are not related. So yeah, so if I'm using only the same system, it's against, because then not, it will not say I use Noble Biocare and I do the study. You are not using Noble Biocare. So you say it's not related to my work. It's only for Noble Biocare. But when I use 50 different systems and in the end my data is not related, I can give a general statement that this and this are not related no matter what. But if I use one system, it's only applicable to that system. Now another ETK will come and say this is not applicable to us. He didn't use ETK. It's only when you use Noble, it's not related. Don't blame us. Ours is related. That's why it has to be, if you want to make a conclusive decision, it has to be on multiple systems, but you increase the data. See, we have 50 cases. The number is high enough to prove significance. If we have like 5 cases, you're right. We cannot. But when you have 50 cases with all of them, there is no statistical relevancy, because now you're looking at 10, you might think, okay, this is not, but when you look at 50 cases and all not related, then any system is not related. It's more powerful study than using one system. All right, so this is the provisional, and okay, now I just don't want to miss what time is it? 8. Oh, 8, okay then. All right, so we didn't get a chance to look at the 4th case, but the moral of the story is, one was the character, and the other thing is, the more you know about cells, the more ideal character you will have to respond to your patient's bad behavior. I'll repeat. The more knowledge you have about the cells, how they live, how they die, if you smoke, when you have so much information and the patient is talking to you, I don't want this, why are you doing that, I don't care, but you know how the cells work very well, you are more convincing as an ideal character to receive patients' trust. Because end of the day, according to Gamer, with thousands of patients, you need the patient's trust to improve their behavior with you. This is the moral of today's story. Don't look for anything. Don't look for, just get the patient's trust. Everything else will be positive in the end. This is what I'm trying to say. So the more you know, the more trust you can get.
And you will trust yourself before you trust the patient, so you will be more ideal.
Yes. So the trust is what you look for. And your knowledge on cells will, when you say something and you're dealing with details, the patient will trust you and they will behave better on the chair. That's what I wanted to say today. Thank you. Thank you.
And if you have